Hi everyone, this is Dr. Stefan. In this video, I'd like to continue the series in which I discuss about what to do when you get a new diagnosis of a chronic lung disease. This one will be about asthma, and I wanted to create a very comprehensive video in which I try to cover everything that you should know if you are a person who's recently been diagnosed with asthma. Because it's a very well-known condition, it's commonly known, but everyone keeps asking the same questions every time in my comments when I see patients, and I think it's important to put this information out there. Of course, I'm not your doctor, so you need to just use your common sense, talk to your medical team, decide what's best for you. Not everyone is the same, but that being said, I want to really get into a lot of detail in this video. I like this sort of long form content, so I'll try to put this up as an audio version on the podcast as well, on Top Lung Health, because I think it's important to just have all the information in one block. Feel free to come back to this video later on. Feel free to listen to it at your own leisure. It's up to you. Maybe you don't find it useful, but I think it'll be a lot of information that you might find helpful. Got plenty of notes to get through. And actually, we won't talk only about treatments because we need to talk about sleep patterns, indoor air pollution, smoking, weight, exercise. What else have I got here? Lots of things. Fresh air, how to seek support, regular checkups, what these mean. So I want to cover a lot of information that you may want to know if you've received a diagnosis of asthma. So just to begin, I'd like to say that asthma is a very, very common condition. It affects more than 300 million people around the world. 300 million, that's huge. It's a huge disease. So if you suffer with asthma, if you've been diagnosed with asthma, you are not alone. There will be other people in your area, in your local area, who also have the same disease. So that's great because you can get some support. And you shouldn't be embarrassed if you have this condition. I know in real life, this may not be as easy, especially if you're maybe a teenager, if you're in a work environment where people may be mocking someone who's using an inhaler or things like that. But I think this is changing. There's a lot more awareness these days. So if you do have a diagnosis of asthma, I think you can actually do quite well to have people understand that you have this condition and to just, treat it with respect. Because I think any condition that you have and anyone who's ill, I think needs to be, first of all, treated with respect because they are working harder to have a normal life. So other people who are not ill maybe don't recognize how terrible it is to get ill. And anyone who's had a cold, for example, and felt really crap for a few days knows how bad it is to be ill when you cannot do your job properly because of illness. So I think a lot more respect needs to be given to people who are struggling with a condition and trying to make the most of it. And I think in this video, that's what I'm trying to cover, to give you some tips on how to manage your lifestyle in a way that's conducive to good outcomes for your asthma. And first of all, I'd like to just start by saying, what will your life be like if you have to be treated for asthma? Not everyone is treated for asthma, but most people will require some form of treatment. Usually, it's in the form of inhalers. And you may think that these are silly little treatments, but they're actually some of the most advanced types of treatments in medicine. I mean it. And anyone who tells you otherwise really doesn't know what they're talking about. This is my feeling, because these little things are so effective at treating most cases of asthma, it's really unbelievable. And especially if you're using them correctly, if you're taking the right doses in the right way, you have a good inhaler technique, you can actually control your asthma in most cases. Majority of cases of asthma are controlled only with inhalers, which to me is amazing. And the great thing about inhalers is that the side effect profile of these medications is really, really good. So most people have few or none in terms of side effects from inhalers. The reason for that being that the doses of medication that you actually inhale every time you use one of these puffs is very little. So the dose is very, very small. And that's a great, great thing because it means that much of the medication just stays within the airways where it needs to act to treat the asthma. It doesn't go in the rest of the body. Now, of course, some people may tolerate certain inhalers better than others. It depends from person to person. So this is why I'm urging you to always discuss with your doctor to find the right optimal treatment for your case. But just to tell you in brief what these little things do, it's really important to just start by understanding that asthma is an inflammatory condition affecting the airways, the little tubes that go inside the spongy tissue of the lungs, carrying the air. When the inner lining is inflamed, This is what happens in asthma. You have an inflammation that can be caused by allergies. It can be caused by a genetic predisposition. Lots of things are there. But you have this inflammation that affects the inner lining of the airways, the tubes that carry the air to the lungs. When you have that inflammation, the little muscles around these airways can spasm, and sometimes they can constrict. And when they constrict, you're trying to breathe in through a much narrower tube, and that means that your air doesn't pass as well, so you're breathless. So this causes an asthma attack. Now, that inflammation itself can narrow the airways a little bit, so you may have some more chronic symptoms, so maybe day-to-day symptoms, but the symptoms can be variable in asthma. And if we control that inflammation, that is the key, because if we control the inflammation in the inner lining of the airway, we can actually control the disease quite well and prevent most asthma attacks, which is the goal. And I think that's really important to understand. Now, most cases of asthma are also mild, so I hope that's your case, but if it's not, there are treatments for that as well. But most cases of asthma are quite mild and very easily manageable with just inhalers. Now, some cases of asthma are a little bit more severe, but there are a lot of modern treatments. Now, every time I go to a respiratory conference, every year there's some new talk about new asthma treatments, which may target eosinophils, which are a type of inflammatory blood cell associated with asthma and allergies and inflammation and allergic inflammation. And then also all kinds of medications that target immunoglobulin E, which is again something that's in your blood. It's a type of protein that is associated with allergies. And there are treatments that target these specifically, which is amazing, because it allows people who have severe forms of asthma to be treated with medications that maybe they can take an injection every few weeks, and it controls their asthma much better than any tablet would. So those are amazing progresses that have been made in the treatment of asthma. And these modern treatments are actually going to change the life of many patients who have suffered with severe asthma. So mild cases, generally, a couple of inhalers probably will do the job. More severe cases, there's a lot more give and take about the treatments, but still the goal remains the same. For most people with asthma, the goal is to have a nearly normal life, to control symptoms very well. So this is the goal. And if you're not in that state, you're still struggling with your breathing, etc., go to your doctor to see how you can increase maybe your treatment to get to that stage where you can actually lead a fairly normal life. And that can be achieved, I would say, in the majority of cases. So if you're a person who's recently been diagnosed with asthma, please do not worry about the treatments. There are a lot of treatments out there, and hopefully one will be great for you. Now, what can you do besides treatment to manage asthma? There's much to discuss here. There's a lot of things that you can do to better manage your asthma. First of all, the first point I would say, and this is valid for any condition you may be diagnosed with, try to read, and understand what your condition is. Understand what asthma is. Like I said, inflammatory condition. If you control the inflammation, you control the asthma. That's really important to understand. And lots of people don't actually understand that, which is a shame, I think, because everyone's droning on about this, especially if you go to a doctor, they will tell you that, but maybe they'll just give you an inhaler sometimes and you don't have all the explanations given, and you think that maybe you become addicted to the inhalers or some other misconceptions that I've seen in a lot of comments that I receive on the channel. There's lots of online resources from charities that deal with asthma, from large hospitals. So there's lots of information you can trust. This is one of these conditions that's so common that there's a lot of good information out there, and this is great. Now, you can also check out some of the videos on my channel. I have a lot of videos on asthma, on how to use different inhalers. Try to get informed in whatever way you think is best. Sorry, I have to take a sip of water because I've got a little bit of a cold, but I'm trying to go through this video slowly. So the second point I would like to say is that you should talk to your healthcare team as much as possible, especially in the early stages when you get your asthma diagnosis. Because if you get clarification on what type of asthma you've got, how severe it is, you may be better off at trying to look for information that's relevant to you. You may get the relevant leaflets from different support groups, all kinds of things that may actually help you to get more clear information about your particular case. But this can be a problem. If you read online randomly about asthma, you might find information that doesn't apply in your case. So, for example, if you've got a severe allergic asthma, it's important to know what you're allergic to and all these other things. So try to get clarification on your severity of diagnosis, what type of treatments might be the best for you. Knowing your asthma triggers is a very important step. So this is something that you can achieve by talking to your healthcare team, sometimes by having certain blood tests to determine if you're allergic to certain things. You may have allergy tests as well, but it's important to know your allergies, especially if you're suffering with allergic asthma, and to avoid those triggers. So for example, if you're allergic to house dust mites, which can be found in house dust, you may make simple lifestyle changes that can actually improve your asthma control by a large amount. If you're keeping your house clean, if you're vacuuming more often, you're using a wet cloth to wipe any surfaces and shelves that are very dusty, you're changing the bed sheets more often, you're shaking off any blankets outside to get rid of the dust, this can actually improve your asthma control by a long stretch. And it's just a simple thing that can be done. So it's important to know these things. For some of these allergens, you may sometimes even be able to go through desensitization therapy. This is something that you can do with an allergy specialist to actually be exposed to low amounts of that allergen that's causing your asthma and slowly become desensitized to it. So talk to your doctor about that as well. This is another thing that many people don't know about. It's also important to know how to recognize when an asthma attack comes on and what to do. And what do I mean by this? Sometimes you may feel a little bit unusual before you get the full-blown asthma attack. So your chest may go a little bit tight. You may feel that there's something going on. And if you recognize those signs early, you may be able to just take the inhaler that relieves the asthma attack, take it early, and it helps you cut that asthma attack as soon as possible. So this is important. The other thing would be to try to get a written action plan. So this is something that I think is really important, especially if you're a person who's recently been diagnosed with asthma, to decide together with your doctor or your healthcare team, what can you use in the event that you're having an asthma attack? How do you treat the asthma attack? What are the doses of your inhaler? How often should you take it? Do you need to use a nebulizer as a second step? Is there any follow-up treatment that you need to take? So for example, if you've been having a flare-up of your asthma, you're having repeated asthma attacks, maybe you need to take some tablets for a couple of days, some corticosteroid tablets, for example, to control the asthma better, to control the inflammation, or maybe you need to increase your inhaler doses for a few weeks to get on top of this situation. You may also have in your written action plan how to recognize when you're getting a chest infection, what sort of antibiotics to take. Sometimes your doctor may actually prescribe some antibiotics to have at home as a rescue pack that you can take when you are getting a chest infection and your asthma is really bad. So signs of a chest infection could be things like you're getting more breathless, you're having more asthma attacks, you're having increased sputum, so you're bringing up more phlegm, it's dark green. Things like that may suggest that you're having a chest infection, and maybe antibiotics could help in that situation if you have access to them readily. So these are, again, things that can be written down. The other thing I would say is it's important on this action plan to maybe have some contact numbers written down. So for family or friends or other people who can help you, emergency services, because in the case of an asthma attack, you may be a little bit confused about what to do, who to ask for help. And if you need some help, if you need someone to take you to the hospital, for example, it might be helpful to be able to call someone. And actually having the written number helps, because if you're fumbling with your phone, maybe your phone's discharged, maybe there's something going on, you can't find the number of your friend. If you have it written down, you know where your action plan is, you know where your medication is, it can help you deal with these emergency situations to prevent, getting into hospital, to prevent getting into a serious asthma attack and a serious problem. So I think this is important. This is not something that I'm saying to you to scare you. I think it's just important to be aware of what can go wrong and what you can do, what reasonable steps you can take in order to prevent worse outcomes. And I think that's really important. The other thing would be, if you're talking to your doctors, to try to be up to date with your vaccinations, because if you're preventing things like flu, again, that helps control asthma in the long run. And if you are prescribed inhalers, know how to use them correctly. So try to see videos online on how to use inhalers. Ask your doctor how to use the inhalers. If someone prescribes to you an inhaler, they should ideally explain how to use it, because every little inhaler has a slightly different technique. I have several videos on the channel if you want to watch them on how to use different types of inhalers, but also you can take the inhaler with you to your consultations and actually ask your doctor at the end, Doc, can I show you how I'm using my inhaler? Am I using this correctly? And you can get some direct feedback on whether you're doing it right or not, because taking it correctly can go a long way to improving asthma control. So this is about treatments. This is about what you can do by talking to your healthcare team. But there's so much more that you can do. So let's get into a little bit about healthy lifestyle and what constitutes a healthy lifestyle for a person with asthma. And some of these things you may think that apply for the general public, and it's true. Actually, if you're having a good lifestyle, you can prevent a lot of disease. And I think most people need more awareness about how to prevent disease. And I think we are bombarded every day with all kinds of bad information, marketing, and all these other things that are leading us down rabbit holes where we're getting more ill, and it's not great. But this is just my personal belief. So let's start off with a good, balanced diet. Having a good and balanced diet is not complicated. It's not hard, but most people don't know exactly how to do that. But basically, simple things, eating lots of vegetables and greens. That's something that everyone can do. It's a habit. You may like to have really fatty foods and things like that, but if you're struggling with asthma, if you have a new diagnosis, I think it's important to try to consider your diet. Just keeping a diary of what you eat during a week. It might be helpful to identify patterns. You don't have to necessarily go to a dietitian, although that can help. But even by yourself, you can actually take the reins, take control about what you're eating, what you're doing, and just see whether you can improve things. So lots of vegetables and greens are part of a good and balanced diet. Having enough protein, so not just relying on sugars and bread and things like that, that's probably not a good diet if you're just eating those things. So fresh fruit, fresh vegetables, things like that are really, really good. What I would say is try to avoid sugar, sweets, and processed food. This is really important. So SSP, sugar, sweets, processed food. If you can avoid these, I think you will probably gain so much in terms of health benefits that it's unbelievable. And it's really, really hard. I think that's really, really hard to do, because if you go to any supermarket, I live in the UK, but if you go to any supermarket around the world, you will be tempted by so many sweets and chocolates and all kinds of things. It's really hard to say no. These things are in your face. Aggressive marketing, shiny colors. They feel good. You eat sweets, you feel, well, it's tasty. They have all these flavors, all these colors. It's really hard to say no. But if you do say no, your health will improve dramatically. I think that's really, really important. The other thing would be fizzy drinks. Who needs fizzy drinks? Do you really need that Fanta? Do you know how much sugar there is? Just always read the label of the actual thing, and you'll see how much sugar there is in these fizzy drinks. And no one really needs that acid, that things. Why Fanta instead of a cup of tea? And having a good and balanced diet goes hand in hand with actually maintaining a healthy weight. Not too skinny, not too overweight. So I think it's really important to be somewhere in between and have a healthy weight. And that actually can help improve your life in a number of ways. It can help you move more. So if you're struggling with being a little bit overweight, you may feel less inclined to exercise heavily because that puts a lot of pressure on your joints. So if you have a healthy weight, you'll be able to do more. You'll be able to reduce your acid reflux. So for example, if you're carrying around a lot of weight on your stomach, that pushes down. So when you're going to bed, obviously you can get a little bit of acid reflux, and that can worsen asthma in itself. There's a known link between asthma and acid reflux. So that can help as well. You'll be able to breathe better if you have a healthy weight. As you can imagine, you're moving less weight, your muscles work better, and you can cope with flare-ups better of the condition. So I think it's really important to just think about that if that's a problem for you. Exercise. So exercise is a whole chapter that I probably cannot get into this one video, but it's really, really important, because if you do something with your body every day, whether it's walking, taking the stairs instead of a lift or an escalator, if you're taking active breaks at work, so rather than go and sit away from your desk on a sofa, to go for a little walk around the office, to have your cup of tea and walk around with it a little bit, interact with someone, I think that's a lot better than actually going and just sitting and being still. That's probably not going to help. Ideally, you should exercise at least until you are a little bit out of breath, out of puff, and then stop and start again. So this is how you do exercise. You don't have to be a champion. You don't have to hit the gym. You can just start with simple things like walking and progressively do more and more, because any form of exercise really is good for your health, and it will help you control your asthma better because your body will function better. The metabolisms of the body will function better. And this takes me to the next step. Having good sleep. Good sleep also helps regulate a lot of the body's function. It's so important. Having enough sleep, quality sleep, will help modulate your immune responses, which are really important in asthma because we were saying that it's an inflammatory disease of the airways. So you can imagine that if you are having healthy sleep, you will have a much better health overall, and your asthma may actually improve. So that's something that I would urge you to consider. Sleep also has an effect on reducing your stress levels, which again are linked to the way in which your body reacts to certain triggers in the environment, how inflammation behaves. And it leads to better lifestyle decisions. If you think about someone who hasn't slept enough, probably they'll make some bad health choices. You can imagine that that's something that, only the rested mind can guide you in the right way. And I think that's really important to just remember these little simple things. Some people really just need to sleep more, and I think a lot of their problems would go away, but that's just me saying this. And I hope you don't take offense by some of the things that I'm saying in this video or think they are too simplistic, because a lot of people just find it hard to implement little changes that can do so much good for their health. With regards to sleep, it's really important to not only have enough sleep, but also to avoid chaotic sleeping patterns. So if you're having a disrupted circadian rhythm, so that's the rhythm that occurs over 24 hours, when you're sleeping, you're awake, this is actually controlled by certain genes in your DNA. So it's really, really a complex system, much more complex than people understand. And genes are awake, let's say, at certain times of the day, and then they are suppressed, and that creates this biological rhythm, and it's really, really interesting. But actually, people who have a disrupted circadian clock, for example, people who work shifts or who have very poor quality disrupted sleep, can have a higher risk for more severe asthma or for other health conditions. So I think that's really something to keep in mind. One way you can improve your circadian rhythms and patterns of sleep is actually to try to avoid watching bright things before you go to bed, because the light actually has a certain effect on how these biological rhythms manifest themselves in your body. So one tip would be to try to start going to bed the same day at the same time most days of the week. If you can do that, that would be great, fantastic, because it will really regulate this biological clock. You can set reminders on your phone to go. I know I have it on my phone, for example, to have reminders on when to go to sleep. I can set the night mode on my phone. There's lots of things you can do. You can silence notifications at night. You can potentially consider avoiding the phone altogether, reading a book before you go to bed rather than reading the news on your phone, which may stress you out some more. The other thing would be to try to avoid watching TV, bright screens, your laptop, not take your laptop to bed, have a dedicated place where you can sleep. These are measures that fall within sleep hygiene. So that actually leads to more quality sleep. The other thing would be to avoid caffeine after 5 p.m. So in the evening, ideally, you shouldn't be having any coffee. Even though you can fall asleep, the quality of your sleep will be impaired if you've had a big glass of Coca-Cola just before going to bed, or if you've had a coffee at 7 p.m. It'll probably affect the quality of your sleep, and you might wake up more tired the next day, and you get into this pattern where you need more coffee and so on. So I think it's really important. The other thing would be to try to help regulate your sleeping patterns, would be to try to go in the light when you wake up. This is something that I've personally implemented for the better part of last year, and I feel great. In the morning, I try to wake up a little bit earlier, maybe half an hour, 1 hour before I would normally wake up, and I just go outside. Most days, of course, some days, in the UK, it can be rainy and you don't feel like going outside, but at least I try to have my cup of coffee looking out through the window to see bright light in my eyes. I try to do that, but ideally you should be outside for 10, 15, 30 minutes to just walk around outside to get that sunlight in your eye early in the morning, because that helps regulate the pattern. And I feel amazing personally doing this for about a year. My energy levels are up. I feel that my mind's a bit sharper than it was before. I can exercise more. My body feels better overall. And when night comes, I can fall asleep a lot easier. So I think that's something to keep in mind if that's something you wish to incorporate to have better sleep. Moving on, we can talk about other things as well. So if you're suffering with asthma, if you have a diagnosis of asthma, try not to smoke. Smoking is really bad in combination with a diagnosis of asthma. And if you've already given up or you've never smoked, congratulations, because this is one of the hardest things to do. And I really, really know that. It's really hard to quit for good. A lot of patients complain about this. It's really, really hard. It's really difficult. And I do understand. It's something very addictive. Nicotine is super addictive. And if you see someone then who is smoking, that can trigger your desire to smoke. And it's a social, physical, psychological addiction. It's very, very complicated. So if you are still smoking, really do consider giving it up if you have a diagnosis of asthma, because it will help you control your condition much better. Just imagine if you're inhaling smoke into your airways and you're trying to treat inflammation in the airways, that's probably not going to help. I mean, it makes sense, but it's just because it's so hard to quit. That's why it's important to try to seek help if you can't do it on your own. So try to understand that you are suffering with an addiction if you are a smoker. It's a very powerful addiction. Read about it, really. There's lots of stuff online on how to quit smoking. I think there are great resources out there. But if you can't do it on your own, try to seek help. Go to smoking cessation services. There are many around the world. There's probably something in your local area. You can ask your doctors. You can ask your family physician. There is nicotine replacement therapy that can be given to you. So it cuts down the cravings by providing you pharmacological nicotine instead of the stuff that you would get from cigarettes. There are medications such as bupropion or varenicline, which can be given. There are tablets that you can take to, again, cut down the cravings. So these can be prescribed by these smoking cessation services. There can be other therapies available depending on where you are in the world. And you do get access to actual counseling on how to quit in a sustainable way so that you can actually sustain it over the long period of time. But try to give up for good. And this includes even vapes and e-cigarettes, because we actually don't know the health implications long term. Even though other people may tell you otherwise, there's actually lots of marketing on pushing e-cigarettes and vapes to the market. And to some extent, in the short run, they may be a little bit better than normal cigarettes, but I'm not sure about the long-term cumulative effects of actually inhaling the vape long-term. I'm not sure. But there's lots of marketing. And to be honest, even I, since I've had this YouTube channel, I get these emails from sponsors and things like that. And I got an email from a e-cigarette company. And that's weird. I would never do that. I'm a lung doctor. Why would I promote that? But you can imagine that if they send these emails out to so many people, some people will end up promoting them. And there's a conflict of interest. There may be financial incentives to doing this. But I'm not sure if 30 years from now, there will be no danger to using vapes. So if you can quit smoking for good, completely, nothing, don't smoke anything, that'll be the best way. And there are actually cases of something called E-Valley, so e-cigarette and vaping associated lung injury. This is a condition in which the lungs have a reaction to the vapes, and it can happen. And these are acute conditions where people end up in hospital. So there are some dangers that are maybe misrepresented or underrepresented, which we don't know about. And we've only really had e-cigarettes used en masse in the last maybe 10 years. But what happens 20 years from now, 40 years from now? Will we have a problem that we just are ignoring at the moment? So if you have a new diagnosis of asthma, I would suggest that you try to just breathe in good old fresh air. If you can, just go outside. Nature is amazing. There's plenty to see. And you can get fresh air rather than smoking anything. The other thing would be try to avoid indoor air pollution. So this is something that, again, is not mentioned very often, but if you have a new diagnosis of asthma, it's something you may want to consider a little bit. Because with indoor air pollution, we're talking about things like smoke inside the house, or not only, but a lot of people around the world, depending on where you live, may have wood or coal burning stoves or fireplaces. So these are great. They look great. They may be helping you to keep warm. A lot of things may be happening. You may not avoid having one of these in your house, but do bear in mind that it can cause air pollution. So make sure that if you do use a stove in your house, it will release a certain amount of smoke that will be lingering in the air, and that can actually affect your lungs. So make sure the chimney is clean, and it should be ideally every year you should check that it's actually pulling the air well. I remember my grandparents, when I was growing up in Romania, I would spend time in the countryside where my grandparents lived. And I know my grandfather was really, really obsessed with clearing the chimneys every summer, because they were preparing for the winter. So in the summer, autumn, they would clear the chimneys. They would ask someone to come and clean them, because they wanted to make sure that the stoves were actually not releasing smoke inside the house. It was a big thing. And I think it's really important to check that. And probably you're already doing that if you're using a stove for heating, but try to make sure that the stove is really working well. There's no leaks, as much as you can prevent that, because it can worsen your lung disease. Also, think about other things that you may be burning around the house, such as incense, candles. A lot of people have these around the house, and they don't think of them as something noxious for your breathing, but they can be. So if you like to use these things, if you're using them for cultural or religious reasons, try to think about maybe opening the windows afterwards to well ventilate the space. And also, think about air fresheners, especially the ones that are aerosol based. So the ones that you puff and the room smells great, but what is that smell? You need to think about what you are actually inhaling and whether that's actually making the situation worse. If you're using hairsprays, aerosol deodorants, things like that, these may actually worsen the inflammation in the airways. So try to be aware of the things around you if you have a new diagnosis of asthma, because it can really be something that you're not thinking about, but it may have an effect. The other thing would be to try to install extractor fans. So if you have a stove, for example, if you cannot control the smoke in your house, to try to have little plugs or in the wall, in the windows, that can suck out the noxious air from around the house, and just opening the windows a lot. I think that's really important. Moving on from these lifestyle things that are really important, I think, and it takes a lot to change habits, of course, but also if you're suffering with asthma, try to seek support. I think that's really, really important. Try to seek support in groups, online, forums, to try to have a place where you can ask a question, but also offline, because keeping an active social life if you have asthma is really important. It's not the end of the world. If you have this diagnosis, you can continue living your life as usual. But you should probably ask your hospital doctor or family doctor whether there's anything in your area that you can join, any asthma support group. It's important for meeting friends, meeting other people who may suffer with the same condition. They may give you tips and tricks on how they manage. Support is also in the form of family and friends, because they can understand you. They probably understand you better than anyone else. And if you tell them that you have this condition and just ask them to just be kind and supportive to you, I think that will go a long way to actually deal with this condition and have someone to turn to when things are not that great, because you will have good days and bad days. But it's important to have someone to talk to. Avoid people who judge you for your asthma. I think that's really something that's quite obvious. Not always possible. We all have the odd friends who will make silly jokes that they may not mean anything bad by it, but if you are struggling with your breathing and someone is teasing you about your inhaler, it's something that you can raise it with them a little bit and probably ask them to not do those jokes if it's bothering you. But if it's an ongoing thing and you're becoming anxious, if you're having issues using your medication because of certain toxic people around you, maybe it's important to try to distance yourself a bit and find more supportive people, because it's your body, your condition that you need to manage in the end. And you don't need to please anyone if you need to deal with health issues. If you're struggling with anxiety, depression, mental health issues, really try to seek professional help early. The earliest, the better, because it can slip up on you. And just don't say that things will get better if you're really struggling with mental health, because sometimes it just doesn't get better. So if you're seeking professional help, sometimes it can go a long way to, stopping things before they get too out of hand. Because some people actually end up becoming defined by their asthma, and I think that's really important to try to avoid. I've seen a lot of patients actually who seem to be defined by the fact that they have asthma, and I think that's not good. It doesn't have to become part of your identity. It has to become just a condition that you're managing, but it shouldn't be your asthma. And I'm saying this because I know some patients who unfortunately do not do this very well. They take on the condition as if it's part of them. And I think without asthma, even if we cured their asthma, they will feel that something's missing. So really, mental health is something really important. And I remember this one girl I've seen in the hospital in an emergency room. She was in and out of the emergency room all the time with her asthma. And she would have these complex treatments, just something unbelievable. She would take so many medications, and actually, I don't think she actually needed all of them, but she always referred to her treatments as my morphine, my inhaler, my Montelukast, or whatever treatment she was on. And she was on a lot of them. And if you wanted to take away some of the medication to try to replace with something else, she would become very, very defensive. So if you're struggling with anxiety, depression, if you're feeling like your asthma is becoming part of your identity, shouldn't be the case. Try to seek support professionally because it can help you cope better and actually see this condition as something that you can manage. The final thing would be to get regular checkups because asthma can be a variable condition. So you may have moments when you feel much better, moments when you don't feel so good. So if you're seeing your healthcare providers regularly every 6 months, 1 year, it's probably a good thing, even if you're feeling well, just to make sure that things are okay. You can do a spirometry or a breathing test to make sure that things are still the same. You can check your inhaler technique. You can do all these things. And then treatment can be stepped up and down. And I think that's really important for asthma to remember that you don't always need to be on the same treatment. So if your asthma is really, really well controlled, sometimes you can try together with your doctor to reduce your treatment for a while, to take less of inhaler doses or fewer puffs, etc. And that can help you liberate you a little bit from all these treatments that you're taking. Other times, you may need to increase the treatment, but doing so will actually control the condition, prevent flare-ups. But I would like to end with this, even if the treatment is not fully resolving the asthma completely, in most cases, it's quite effective at getting you close to leading a normal life, or to not be limited in the activities that you can do. And there are even sports stars that had asthma and they still manage. So try to remember that it's not an identity. It's not something that you cannot manage. Good lifestyle choices make a huge difference. It's not only the treatment, but if you understand this condition, you understand how it works, what's causing the problem in your body, you can treat it effectively. You can avoid things that make it worse. Sometimes you need to be your own doctor in some ways, and I think that's really important. And most doctors, who, at least the good ones, will probably appreciate you being an informed patient, someone who knows about their condition, knows how to take control of things when things go wrong. So hopefully you found this helpful. A bit of a longer video today, but I thought I'd cover everything and hopefully it was helpful. If you have any further suggestions, if you think that I've missed something, please leave this as a comment in the section below, and I'll see you in future videos. All the best. Good health.